In this lecture, we are going to discuss different extraoral radiographs we take in dentistry in general and particularly in oral surgery. This is the lateral jaw radiograph. We keep the film, the image receptor, in this manner, and it is lateral, sagittal plane of the face or head. This is how the radiograph appears. Purpose of this type of radiograph is to examine the posterior region of the mandible, third molars, especially when Panorex machine is not available. When children or adults are unable to tolerate placement of an intraoral image due to fractures or swelling. So you can easily identify any problem in the lower molar region using this radiograph. This is the lateral oblique view. You can see inferior borders of the mandibles on both sides, inferior border of the both side of the mandible. You can see both the condyles. You can see both the sigmoid notches, and you can see both the coronoids. You can also see third molar region. In the absence of an OPG, the lateral obliques will demonstrate the body and ramus on each side. The articulation at the temporomandibular joint may also be assessed using this radiograph. This is a lateral ceph. Most commonly, it is being used in orthodontics as well as in orthognathic surgery. Purpose of this type of radiograph is it is used before and after the ortho treatment or before and after the orthognathic surgery. It is also used to evaluate trauma, growth development, developmental abnormalities. It also reveals facial soft tissue profile by placing a filter between the tube and the patient to remove some of the X-rays. And size of this radiograph is 8 inches into 10 inches. Posteroanterior or cephalometric posterior radiograph. Purpose of this type of radiograph is to examine facial growth, development, diseases, trauma, abnormalities. It is used to supplement the lateral surveys because right and left sides of facial structures are not superimposed on one another with this method. So you can easily find any facial deformity. This is the Waters view. You place the image receptor in front of the face. You take from the posterior region this X-ray. This is a posteroanterior radiograph. Tip of the nose is 3 to 4 inches away from the receptor and chin is touching it. On this radiograph, you are able to see the frontal sinus, bony nasal septum, inferior orbital rim, anterior nasal spine, zygomatic bone, zygomatic arch, maxillary sinus, coronoid process, condyle. Then you can see the petrous ridge, mandible, mastoid mandibular angle, and odontoid processes. Check out how beautifully odontoid processes visible over here. If you want to assess the fracture of the middle teeth, it is a very good X-ray. This radiograph is also being used to evaluate the maxillary, frontal, and ethmoid sinuses. This is the reverse Towney. Again, it is a posteroanterior radiograph. Patient is asked to stand with mouth open and head tipped down. Purpose of this radiograph is to evaluate and examine fractures of the condylar neck, as well as it is used for scleroderma and arthritis. Assessment of scleroderma and arthritis. This is actual Townes view. This is the original Townes view, that is an anteroposterior projection. It was designed to show the occipital region but also showed the condyles. Check out the occipital region. From the X-ray, you can see foramen magnum. You can see the foramen magnum, dorsum sale, occipital bone, internal acoustic meatus or internal acoustic canal, mastoids, condyles of the mandible, and lambdoid suture. This is submento-vertex radiograph. Submento-vertex radiograph is used for the assessment of condyles and fractures of the zygomatic arch. It is also known as jug handle view. These two zygomas, they appear as if handles of a jug, and rest of the skull, it appears like a jug over here. Transcranial X-ray. Transcranial X-ray is used to evaluate the temporomandibular joint. This is your temporomandibular joint. This is the external acoustic meatus. This is the mastoid, the clinoid fossa. This is the articular eminence, and this is the condyle. This is Caldwell view. The purpose of this X-ray is to study the frontal sinuses. In this position, the frontal sinuses are in a direct contact with the film, hence there is no chance for any distortion or geometric blur to occur while taking this radiograph. You can see the sagittal suture, lambdoid suture. You can also see frontal sinuses. Then you can see ethmoidal sinuses. You can see the cribriform plate and inferior orbital rims, as well as mastoid air cells and maxillary sinuses. Check out maxillary sinuses. You can also see nasal septum and base of the skull. This is Caldwell view. When we take an OPG, the whole face appears like this on the film. You can see external auditory meatus, mandibular condyle, articular eminence. You can see zygomatic bone, as well as the coronoid process, articular pterygo. You can see the pterygomaxillary fissure, and you can see inferior orbital rim, anterior wall of the maxillary sinus, nasal fossae, hard palate, inferior orbital canal and foramen, floor of the maxillary sinus. You can also see the fossae, and you can see the lateral pterygoid plate. You can see zygomatic process of maxilla, as well as cervical spine. At times, cervical spine is visible on both these sides. You will see external oblique ridge, inferior border of the mandible, mental foramen, and this is hyoid bone. Inferior alveolar canal, and at times you will see ghost image of this side of mandible on this side and ghost image of this side of the mandible on this side. This is hyoid bone on both sides. So over here we are done with our radiology, and soon we are going to start with our other topics. So see you then.